Hello and welcome to Medical Talk. I'm your host, Betty LaMarr. Today we are on location on the red carpet. My very special guest today is the master, Dr. Robert Wegner. Now today we're going to talk about trends. We're going to talk about weight loss trends. And one in particular that I need Dr. Wegner to explain to you and to me is where individuals, or people rather, are going over to other countries to have a surgery that they can have right here in the United States of America. I personally think that we have only the best. Well, hello, Dr. Wegner. Welcome to Medical Talk.
Hi, Betty. Thank you for having me back.
Okay, always. Now, Dr. Wegner, before we get it started, I always like for you to tell everybody who you are, what you do, and where you do it.
So I'm Robert Wegner. I'm the medical director at St. Francis Hospital for weight loss surgery. I've been in the Memphis area since 2010. I've done close to 6,000 weight loss procedures for the patients in the area, and really patients have come from all over to have their procedure done. I do gastric bypass and gastric sleeve, which are the two most popular but also the most effective surgeries for surgical weight loss. And I've been at St. Francis the whole time doing that, and we have a team there, not just in the office but in the hospital, in the operating room, that's really been with me consistently the whole time. So we do a great job getting patients ready for surgery, obviously during the surgery and then after the surgery. So when you talk about in your intro going out of the country to, or somewhere really far away to have this done, in my opinion, if you have insurance and you're going to a facility out of the country, I really wouldn't understand that decision if you have insurance to have it done here with the expertise of what we provide versus going to, say, I think the most popular area is probably Mexico from this area, whether it's just across the border or to a resort town like Cancun or Cabo or somewhere to do it. The message I think I would tell somebody is, first, I would want to know why you're doing that. Is it that you're embarrassed to have it done here locally, or you don't want people to know? That would be one of the only reasons I could figure out if you have insurance and you still traveled, is you'd want to do it in some type of secret, anonymous way and then come back and then no one knows you had it done. But they're going to know you had something done if you lose 50 to 100 pounds in the next year. You could say, oh, I didn't have surgery and not admit to it, but I don't think it's anything to be ashamed of.
No.
Personally, this is what I do. It's my life's work. It's a beneficial surgery. It changes your life. But to risk going to a facility where there really is no significant preoperative, getting you ready for surgery, beside your check clearing and your credit card clearing, and you making the travel arrangements to go there, and then in the operating room, who knows what's going on? I don't know what the standards are there. And then post-operatively, I can tell you that once you come home, you're pretty much on your own. And so, I think from a cost standpoint, if you have insurance and go, I really couldn't explain it. Now, some people don't have insurance, so they think that, they want to have a sleeve or a bypass, and they see an advertisement in Mexico for $5,000 or $6,000, so they're going to travel down there and do this. Well, I think the cost of an out-of-pocket sleeve is somewhere around $12,000 to $14,000. So I would say, for not a lot more money, okay, maybe it's double the price, from say 6 to 12 or 7 to 14, to take the risk of going to Tijuana or somewhere over the border to have this done, and when you could have had it done here with all the advances that we have in these hospitals and how we take care of patients and our outcomes, and we take care of the complications, things like that. To travel down to Mexico is probably not what I would think would be a good idea. But I see it. People ask me. People say they have friends or family members that have done it. Some have disaster stories and some don't. Personally, I think it's a little risky. I wouldn't recommend it. If you just insist on going out of the country to have this done, you've got to make sure you're going to a surgical weight loss center that is certified by the ASMBS as being at least, you know, the equivalent of a center of excellence through the ASMBS. Otherwise, you really don't know what you're getting. Like when you want at least a standardized level of care that you know that pre-op and intra-op and post-op you're getting the best that's available. ASMBS centers provide that. If you're going to some physician down there who's hung a shingle out and says he's doing weight loss surgery for $5,000, I just don't think it's worth it.
No.
I think it's too risky.
And you know, I'm going back to something you said, and it's so true. Because I know of an individual that went over there, and I think what you said about trying to hide it, and so nobody would know. We would think all of a sudden you're a size 2 because you did it on your own. The reason I know that she was upset about it was because her mom accidentally mentioned that she had had a sleeve in Mexico.
She was trying to keep it a secret.
And she wanted us to think once she lost all the weight that she did it on her own. I'm like, this is so crazy. You could have got the infection and been dead.
Yeah.
We would have known anyway, right? And let me ask you this too, because...
Well, let me just say, getting weight loss surgery is not, and the perception is that you're taking like a shortcut or the easy way out, or you're doing something that's quote unquote unnatural or not safe, or whatever the misconception is. I can't say that that's further from the truth. We know that obesity is a hormonal disease, and I've been saying it, you know, for over a decade. The bariatric surgeons have known it for decades that obesity is a hormonal disease, and it's not necessarily based in lifestyle, you know, eating habits and exercise. It's really your hormones that control your fat set point and where your body wants to be. And everybody's body is different. And some people are just prone to have a higher fat set point, and they're going to maintain a higher body mass index, a higher BMI. Surgery can change that. Exercise and eating less does not change your fat set point. That's genetic, it's inherent. So you're constantly battling your genetic set point for the level of obesity that you're going to attain through diet and exercise. And that's fine. Some people can battle that all their life and they can keep the weight off and they're constantly watching their diet and exercising and this and that. Some people, no matter what they do, they cannot lose weight. Or they can lose 20 pounds and then they just get stuck. They get frustrated and then they regain 30. Then they lose 30 and regain 40. And it's this up and down and back and forth. And so since we know that it's a hormonal disease and the new medications on the market now, unfortunately, they prove it. You're giving somebody a hormone agonist. And so, you know, a few years ago, oh, just eat less and exercise more. Now they're actually admitting to the fact that it's a hormonal disease.
Yes.
So there's nothing embarrassing about saying, listen, I'm going to take control of my body. I'm going to take control of my fat set point. I'm going to change it. I'm going to get a gastric sleeve or a gastric bypass, and I'm going to lose, you know, 50 or 70% of my excess weight. That is not taking the easy way out. That is taking control of your body and wanting a healthier lifestyle, a healthier life, getting off the medications for diabetes and high blood pressure and high cholesterol and acid reflux and joint pain, all these things that these people are taking, and even the weight loss medication. My goal is to get patients off of medication, not to add one more medication into the list of 10 or 20 they're already taking, okay? So, you know, patients are, you know, this is not the easy way out. Don't be ashamed. You know, thousands of people have done it. They've been successful. I've helped thousands of people. I don't think one of them, post-operatively, a year or 2 years later, would feel ashamed about doing it. I think they're proud to do it.
They are.
I think they're proud of the changes that they make. They always want to talk about it. They always want to show you their picture. They always want to tell you what they're doing now that they couldn't do then. And so it's very rewarding, you know, to hear that, and the patient's enthusiasm about their surgery is great. And that's what surgery provides.
Now, you know, my most favorite is when you describe the two surgeries. I mean, no
The
one
sleeve and
can
the
do it
bypass?
like you.
Yeah.
Yes. So break down to our viewers that may not have. I don't know how they have it because you was on Monday night, but
Sure.
So break down those two surgeries.
Yeah, just in simple terms, the similarities of the surgeries are many, and the similarities are in the surgeries that I'm talking about are gastric sleeve and gastric bypass. Both surgeries are performed laparoscopically, meaning that's the same as robotic and laparoscopic. That's kind of an interchangeable term. It's just the robot with the arms versus me being the robot with my arms doing the surgery. But the incisions are small, 1 centimeter to 1.5 centimeters. They take about an hour to perform, as far as an hour under anesthesia. The patients usually stay in the hospital one night, sometimes outpatient, sometimes inpatient, but a one-night stay, and then I send them home the next day. Sleeve and bypass, both go home on post-op day 1. And the recovery when you get home is anywhere from a week to 10 days. You just want to let the wounds heal, no heavy lifting. But daily, routine, daily activity, driving, going upstairs, taking a shower, sleeping on your side. I get asked all these questions all the time. What are my limitations? The only limitation post-operatively for both surgeries is just heavy lifting.
Okay.
For a couple weeks, just kind of take it easy. And I like to keep the patients on a liquid diet for a week or two while the staple lines and suture lines are healing, just to not stress the GI tract out. Those are the similarities. And then the diets are the same, the vitamins are the same. Everything's really identical for the sleeve and the bypass as far as what the patient sees or feels. The only difference is what I do while they're asleep.
Okay.
So the gastric sleeve only involves the stomach. So the stomach, naturally is kind of shaped like, just call it like a football. And when I'm done with it, it's going to look like a banana. So I'm going to remove, 70 to 80% of the stomach permanently. I just cut the side of it right off, take it out of the body, and it's gone. So you're left with a very thin, narrow stomach, which obviously is restrictive. You can't eat as much as you used to with the larger stomach. And then there's also some hormonal benefit to removing that part of the stomach as far as your hunger drive and satiety and that kind of thing. So you get some hormonal benefit out of the sleeve also. But it only involves the stomach, okay? That's the gastric sleeve. The gastric bypass not only provides restriction by making the stomach small, but it also alters the route of where food is directed once it gets into the intestine. So a portion of the intestine is intentionally bypassed, and a portion of the stomach is bypassed. So you have to eat less, obviously with the restriction, but now you've got kind of a different tract of where the food goes. So that anatomy that I create with the gastric bypass has profound effects on the physiologic communication between your gut and your brain. And that is what controls obesity.
Okay.
It's not your exercise, it's not your, how much you're eating per se, but all of this is controlled by hormones. Your intestines and your stomach and your brain all communicate with each other constantly, before a meal, during a meal, after a meal, even when you're not eating throughout the day. There's constant hormonal feedback between your GI tract and your brain. The gastric bypass, through multiple different pathways, control your appetite, increase your metabolism, increase your satiety or feeling of fullness, and lower your fat set point. I will say that the newer drugs on the market work on one pathway, and that's the GLP-1 agonist. That's the hormone that they're acting on. The gastric bypass works on multiple pathways. So the medication, although efficacious, is still not as effective and doesn't affect as many pathways that the surgery does. Surgery is still the gold standard. The gastric bypass is still the gold standard for overall weight loss and durability and long-term control of obesity. So those are the differences between the two surgery. The complication rates are very similar. They're all, I would say, less than 1%, 0.5%, even lower than that sometimes. We look for leaks, bleeding, blood clots, bowel obstructions, things like that happen, and ulcers, post-operatively, but they're all very rare.
But how can a person know if they have those complications if their surgery, if they don't have a follow-up because they have the surgery?
Yeah, if you go to Mexico
Yeah.
and come back, a week or two later, and you start having a complication like a little wound infection, or you think you have a leak, you got a fever, your heart rate's high, you don't feel well, a blood clot, you got swelling in your leg, and that can go to your lung and be a pulmonary embolism. You can die from that. I mean, there are some serious complications that, first of all, you have to be made aware of, which who knows what they're telling you in the Mexican,
telling you you're
weight
gonna be
loss
living
center,
in the resort,
right? Versus what we're going to be getting here, the follow up with me in my clinic and at the hospital and everything that we do for patients, and because we don't want those things to happen. They can happen, but if they do happen, what are you going to do? Are you going to go down to the Memphis airport and book a flight back to Tijuana? No, you're going to go to your local emergency room and hope to God somebody can help you. And
That's right.
that is not a position that I would want anybody to be in, because we don't really know what they did. We have to try to go in and figure it out and try to fix it. It's just not an ideal situation. You really want to go and have this surgery done with somebody. First of all, you've investigated, maybe you know some patients, they're local. If you have an issue, you can call them, go to their clinic, this and that. So these are all things I think about and that I recommend to patients. But ultimately, I always say it's your body, it's your decision. I will be here for you and help you, as much as I can, before, during, and after the operation. But if you decide to do something else or go somewhere else, well, all I can do is give you my best advice.
Okay, well, is there a point in time after either procedure that you're just over, finished, done, you never have to come back again for any follow-up?
Not really. No. One of the short answer is no. One of the big things that separates a real quality bariatric surgery, or weight loss surgery center is the follow-up. We have yearly follow-ups every year after surgery to check, vitamin levels and nutrition levels and monitor weight loss and weight gain and activity levels and make sure that you're, not doing anything you're not supposed to be doing, like smoking cigarettes, drinking alcohol, whatever. And we monitor the patients. We're always available for that phone call where a patient wants to come see us. We also reach out to them and have them come back. And that's every year for the rest of your life. In the first year of surgery, you see us 3 to 4 times for follow-up, every couple weeks, every couple months, and then 6 months, and then a year. So the follow-up is key. The surgery, again, is just a tool. That's why I say it's not, the easy way out, and that's not the way to think about it. I'm just creating, or I'm giving you the best tool possible to help you lose 50 to 70% of your excess weight. The patients don't have a tool now. The only tool they have is to eat less and exercise. And that tool obviously is not working. So I can perform a surgery, the sleeve or the bypass, which is the tool that they're going to use to create the changes that they want. And so, you have to be able to use the tool, but we teach you how to use it correctly, what to do and not do.
Now, you made me think of something. Another trend, I don't know how true this is, but a celebrity, if you will, recently passed away. So we found out a little bit later that she had undergone some kind of weight loss surgery, but she wasn't overweight in the first place. Some people just get really so obsessed, especially celebrities, that they have to look a certain way. And she ended up passing away. And I want to give you a compliment because during one of my interviews, we had just finished, and of course we don't name names, but someone that wasn't a candidate asked you, could I have one? I guess had you said yes, he would have done it even though you asked Miss BMI or whatever. You said no. I wouldn't do it. I couldn't do that because it have to be according to
Correct.
a standard. And I was like, that was so cool. Because if you was just some doctor doing this for money, you would have said, yeah, hey, come to my office Monday morning. But you knew that he wasn't.
Correct.
And this girl died because someone should have told her that she was not overweight and the gastric bypass was not going to make her skinny, and she ended up dying.
the whole thing with that celebrity, and we all know who it is, and we're not going to mention the name, but yes, it's a tragedy. It's a tragedy at so many levels. I would bet, it's dollars to donuts that she was not getting good post-operative bariatric care. I would bet that she had the surgery done many years ago. It may or may not, as we've speculated, even been warranted to have been done. Was she morbidly obese? I don't know. I don't know when it was done or what her weight was. I don't know. I can tell you we do know that she had an addiction problem with multiple forms of substances and substance abuse. That is a deal breaker for a bariatric surgery patient. You are screened, you are blood tested, you have to have a psych eval. If you have any addictions of any of those drugs that she was on, you are out. No one should be doing surgery on a patient that has a substance abuse problem. You're just asking for trouble.
So why is it that some doctors, and that same thing happened to Michael and the rest of them, so why does doctors, because you're a celebrity, do those kind of things when they already know it's not right? Like you told that person, no, I couldn't do your surgery because you're not like obese.
I don't know. Maybe the doctor's starstruck. Maybe he wants to do something, for a celebrity.
In her favor or something.
Yes. Who knows what the reasoning was? But
see,
at the end of the day, I always say, whether you're a celebrity or not, you put your pants on one leg at a time.
That's true.
Like everybody else. It's the same human body. I don't care if you're a celebrity or, not a celebrity.
Or Dr. Wegner.
Or whoever.
The master.
You have to treat everybody like a human body. Well, I don't care who they are in the realm of life, but they need the same pre-op care, the same intra-op care, the same post-op care as, Joe Nobody. Just because you're a celebrity doesn't mean you should be treated any differently in that circumstance. So who knows, like I said, the whole thing's a tragedy from top to bottom. Yeah. And I hated to hear that because I can tell you with 100% certainty that weight loss surgery is one of the safest surgeries performed in the entire surgical world. Our complication rate, morbidity, and mortality is extremely low. It's extremely safe. We can't really make it any safer beside, just basically the general risks of having surgery, which are inherent with any surgery. But to hear that, I was questioning like, oh my God, did she die from that surgery? Did this and that? I would have to say, no, I don't think that was the cause of her death. I think there were a lot of other things involved. But the fact that she had that in her medical record,
interaction,
all of a sudden there's this kind of black cloud over weight loss surgery. So I'm like, oh my gosh, now I have to not defend that, but kind of explain it a little bit.
Yeah.
Which I'm glad to have the opportunity to do it, and I'm not afraid to talk about it. But I think in that instance, it's kind of a special situation, and unfortunately, I hope it doesn't deter somebody who's thinking about having a gastric bypass or a sleeve from doing it. Like, that would be a bad thing if that prevented somebody who was wanting to have it done, and that was the thing that said, oh, she died from that, or they said that was involved and I'm not going to do it. That is a bad reason. That's not the reason.
Well, if anyone like me that absolutely was a fan of Dad, automatically I've followed her over the years because of Dad, right? And I've never seen her at any point over the years an obese person.
Yeah.
Because it would have been everywhere. Look at her.
Yeah, I
boom.
didn't. Yeah, I mean, I'm not from the area.
Oh,
I know,
yeah.
That whole family and everything about them is a legend here, and people loved them. And there's an outpouring of love for that whole family, and it's just tragedy keeps striking.
Yes.
Some of these families, and they're one of those families that just seems to always have a tragedy
like the Kennedys,
involved.
like a curse.
Same thing.
And drugs,
which is
drug-related.
And at the end of the day, there's always some substance abuse involved. It's
and
somewhere along the line.
And you notice too, any celebrity that get really overweight after a while, when they've been used to seeing them, like small, they're gonna blow them up in the tabloid. They're gonna blow them up in the news.
Yes.
You're gonna see them.
Yep.
So you've never seen her in that shown as a big person. So obviously, I think maybe she just had some issues within herself.
Talking, and I'm working with patients where the obesity is a life-limiting factor. Like they've increased their risk for stroke, cardiovascular disease, cancer. They have many medical problems directly related to obesity, high blood pressure, type 2 diabetes,
The
acid
word
reflux,
you use,
joint pain.
morbid.
Morbid, yes, morbid obesity. Not just obesity, but morbid obesity. There's classifications based on the BMI. But yeah, 35 and up, it's really surgery is the treatment. Under 35, in the 30 to 35 area, there is plenty of data to show that a lower BMI with type 2 diabetes is a good gastric bypass candidate. The gastric bypass is so powerful of an operation for a type 2 diabetic that even before the patient loses any significant amount of weight, the diabetes can subside and they can get off their medication within weeks or months before they've lost even any significant amount of weight, which directly correlates to my statement earlier that this is a hormonal operation.
So I want you to wrap this up in the last 2 minutes that we have. What our viewers will be looking forward to, and give them also your contact information.
So in closing, I would say yes. If you're considering weight loss surgery, look at the center you're going to. Look at the surgeon who's going to do it. Make sure it's a center that's certified by the ASMBS as having all the credentialing for taking care of patients pre-op, intra-op, and post-op, and there is lifelong follow-up. Those are the keys. Go to a surgeon who's been at a facility for a long time, has a track record, has a following. Talk to them, ask them questions. This is a very complex operation, and unless you do it all the time, every day, every week, every year, you're not going to be as good as someone who does do it that often. And then talk to the patients, talk to the dietitians, see what their recommendations are, and don't, as I said before, feel like this is an easy way out, or taking the quick route to getting into better health or losing weight. It's only a tool. You still have to work and make some lifestyle changes and food choices changes, and live within the parameters of post-operative lifestyle. But if you do those things, the weight should stay off, you should be healthy, your diabetes should go away, your blood pressure should be lower, your joints should feel better, your acid reflux should go away, your sleep apnea, you won't use the CPAP. There's just a multitude of medical problems that will be cured after you have a gastric sleeve or a gastric bypass.
Okay, in closing.
And don't add more medications.
Don't add more medications.
The idea, like I said, my goal is to not say, oh, here's another medication to control your weight. No, I'm trying to get you off of all your medications and have a healthy lifestyle and control your weight and just not have to worry about taking anything.
Okay, and you are, and what do you do and where do you do it?
The website is memphisweightlosssurgery.com. I'm Dr. Robert Wegner. I'm at St. Francis Hospital. I've been here, this is my 13th year at the hospital. I've done close to 6,000 primary weight loss operations. I think, I encourage you to go on the website, look at the information, look at the patient testimonials.
We want to thank you all. Tune in Monday nights at 7:00 p.m. on Comcast Cable Channel 17. And if you want to watch the show in full HD, you can scroll up to channel 1091 and you'll see us there too. Thank you. And you'll see Dr. Wegner on part 2 next month.
Yes.
Thank you, Dr. Wegner.
Very good. Thank you, Betty.
You're the best.
Thanks.
Thank you for watching Conversations with Betty LaMarr. Conversations are focused on people like you uplifting the city of Memphis. Visit Betty's YouTube channel, Betty LaMarr Memphis, for more great shows. Be sure to tune in on Mondays at 7 p.m. for Medical Talk with Betty on Xfinity Comcast Cable.